Dr. Piskin, tell us a little bit about bleaching or whitening kits. There's a whole bunch of stuff we can buy in the CVS store or anywhere at Walmart or wherever we buy that stuff in the pharmacy. Then there is like trays and stuff the doctor, the dentist provides, take-home trays and stuff. And then there is apparently machines and laser and whatever lights, zoom lights, which make it. Can you give us the need and the use and the workability of each one of those categories?
I'd be happy to. The whitening has been around for a little bit of time now, and the products have changed a little bit. There's all different degrees of strengths of whitening products. Obviously, the stronger products have dental office and the hygienist, and the weaker products the government or the FDA has allowed to be sold in the drugstores. There's companies that make little trays, little strips that you put on your teeth that you can buy over the counter. They make special pastes, but they don't really give you much results. You know, if you're looking for a little light touch-up, that might help you. But if you really want to get out the stains that have built up over the years and make some degree of change in your whiteness of your teeth from drinking coffee and tea or other foods that might cause discolorations and berry juices, then you have to have more of a professional whitening. And there's two types in the office. One custom made, and you can put the whitening gel in there, and you can do it at home at your convenience. Some products you can just do it during the day for just a half hour, or there's products that you can do it while you're sleeping, and that works relatively quickly, and it gives you a great result. And there are others where you might have heard of a laser whitening or a zoom whitening or lamp whitening. But today the products are geared towards, we don't need the lights as much anymore, the lasers. You can just come in and have it in a one-time sitting. It's something that you can't do at home because the product is very, very delicate, and we don't want it to hurt your gums. So we do it here in the office. It can be irritating to your gums if you don't control it right. So that kind of product is not sold in the stores. So, summary, if you're looking for just something simple and you want to try the over-the-counter, most patients will say they didn't really get what they wanted as far as the whiteness, and then they would have to come to a dentist to do either the whitening with the trays or sitting in the office in the chair and doing chair-side whitening. But it's pretty easy to do. It's painless, and the results are fantastic. And then most of the patients can then touch up. When they come in, they might just get a little touch-up once in a while. Depends upon their habits at home with how much tea and coffee they're drinking, or red wine might stain the teeth a lot. And it's amazing what can happen of 20 to 30 years of staining your teeth and then going ahead and whitening it and having it happen within a very short time. So we do get a lot of people that are brides, business people, or just everyday household mothers and everyday fathers who just say, I look dingy, I need something just to brighten up my smile. It's very easy to do, and it's not very expensive at all.
Right. So it looks to me that to a certain degree, because I'm very sure that buying something in the pharmacy versus doing a similar tray with stronger material and probably more custom-made, meaning better fitting in the mouth from a dentist, costs more with a dentist than at the pharmacy. And at the same time, when you go for even faster and shorter way of doing it, meaning you sit an hour in the chair, it looks like that the price goes up and the time you need to spend on it goes down, versus having weeks and weeks and weeks of having to put a tray in it for several hours. You can put a tray in it for less time because it's stronger with the dentist, or you can even sit at the dental chair for only an hour and you're done with. So you exchange money for your time, and it all depends, how much time do you want to put in it, how much discomfort, because, putting the tray on got to be a little bit uncomfortable. I don't care what people say, I've never done it, but it got to be a tiny bit uncomfortable. And again, you have to do it, and you have to be consistent with it. So if you can, for some people, paying a few $100 more and having it done in an hour and over is probably the solution. And other ones say, oh no, that's all right. I watch TV every night and I do it there for 2 hours or whatever it is, and I'm fine with it. But is that about the analogy?
That's
you exchange discomfort and time for how fast you want it done? Okay. All right.
Right. You can get stuff in the drugstore. Yeah. The stuff in the drugstore, you might have to put the strips in for 30 days to see anything, Or, in the office, like you're saying, if you are the lazy type and you just want to just take care of it today, I don't want to come in and you can sit in the chair, we can do it for you that way. So, yes, you're right.
Well, it's a little bit like when I grew up in Austria and I went to this, there's this mountain and this gondolier going up and they charged me, at the time it was 180 shilling, which I don't know what that is, $10, $15 or whatever. And there I was, a young guy, and kind of go, shit. That's no good. I don't have that money, or I want to spend it on something else. And this guy there said, well, that's not a problem because you can walk up there. It costs absolutely nothing.
So what did you choose? Did you choose to walk up?
No, I paid.
You paid. And as you're going up in the gondola, you see everybody down below sweating and struggling, and you said, I made the right choice.
Yeah, I guess so, something like that. No, yeah. Well, all right. And let me ask you, I think you mentioned it, but I just want to make sure. So when a person does a bleaching, either way, whether he uses an inexpensive thing or he uses your custom-made sprays, or he uses the lasers and whatever, the lights are out there, which you do in an hour, if after 1, 2, 3 years he gets stainy again, because chances are he doesn't change his habits. He's going to keep drinking coffee, going to keep drinking red wine, and does smoking or whatever it may be. He's probably going to keep it up. Can it be done again?
Absolutely. Those that have whitened, the next time they want to do touch-up, the teeth and the staining, it responds much quicker, and they get a much nicer result. So, yes, if you, after a year or two, you say, I just want to touch up again, sometimes we just do some touch-up stuff with their kids so they can do it again. They'll respond very nicely.
So it's not like with a heart bypass where after you had one or two of them, it becomes critical to do another one. You've got to change your lifestyle.
No, we're not relating that to heart bypass at all. No, it's a easy, painless procedure.
I love it. Thank you very much, Dr. Piskin.
You're welcome.